Hello, good afternoon, everyone. I hope everyone's having a great Friday so far. I'm going to wait a couple of moments, let more people hop into the room, and then we will go ahead and get started in a few.
Wherever you leave, whatever you do, remember, health is wealth. Whatever you do, this post-breast cancer needs everyone to care. This global illness needs everyone to care. Now wherever you go. Yes, we know we must win. We will fight this thing called cancer. We are champions. We are black people. We are care. We will win. Yes, we know we must win. We will fight this thing called cancer. We are champions. We are black people. We are care. We will win. If we fight, we won't lose. We won't fail if we faint love. We will overcome. Prostate cancer wherever. No matter what we do, we know we fail at all. We know we fail at all. We know we move forward. We know they give up for life. Because I care, you care. Yes, we know we must win. We will fight this thing called cancer. We are champions. We are black people.
All right. Hello. Good afternoon, everyone. My name is Bims Odadina, and I am the media director here with the iCARE Consortium. I just want to thank everybody for coming out today and wish everybody a happy Friday. Today, I'm very excited to share 2 episodes from our original series here at the iCARE Consortium, and that is Men's Health Matters. Men's Health Matters highlights important conversations around men's health as well as their lived experiences. Now, we will begin with our first episode for today, and then afterwards, we have a very special surprise. I won't give too much of an insight as to what that is. You'll just have to stay tuned to watch. And then after our surprise, we'll go ahead and get into the next episode of Men's Health Matters. So, without any further ado, I will go ahead and get that started.
Prostate cancer is an enemy.
Hello, welcome to Men's Health Matters, and I'm Floyd Willis, a primary care physician at Mayo Clinic in Florida and a member of the iCare team. We're here to introduce you to Quincy Wimberly. He is going to talk about the exciting work that he has going on in our project with iCare, and I will turn it over to Quincy and have him introduce himself and tell us a little bit about his role.
So hello, everyone. I'm Quincy Wimberly. I'm a current program coordinator in Dr. Odena's lab at Mayo Clinic. Kind of matriculed into this line of work and here today through my background in public health. I have a bachelor's in public health and a master's in health informatics. Did a lot of community work, working with the state of Florida, doing some nonprofit work, and now it kind of led me here today with research, working in research currently up under Dr. Odena's lab and facilitating her project.
I think that's fantastic. Quincy, tell us a little bit more about the project and the collab and what your
Yeah.
sort of goals and objectives are for the project.
Yeah. So the current project I work on is currently called Community Learning Lab. So it stands for CoLab. It works primarily with the American Legion Post,
Mhm.
and it aims to address prostate cancer disparities, education, and those aspects of the social determinants of health to empower our men.
Mhm.
So this is a clinical trial that
Mhm.
is currently going on with, it has 4 American Legion posts involved, St. Johns County, St. Augustine area. We have 2 in the Jacksonville, Florida area, as well as one in DeLand, Florida,
Mhm.
as our comparison site.
Yeah, so it's really interesting. Community Learning Lab.
Mhm,
I would love for you to tell us all a little bit more about that
mhm,
whole concept because when most of us think of lab, I mean, I'm a
mhm,
practicing physician. And when I think of lab, I think of some test tubes and some samples and white coats.
mhm.
But that's not really what we're describing
Yeah,
when we say lab here. Can you tell us a little bit more about
yeah.
the learning lab and the whole concept?
Yeah, so it is very interesting approach. So what we mean by lab, um, we aim to utilize this space in the American Legion Post. It housed a lot of our veteran personnel, veteran staff, the veteran community at large. So we're targeting Black communities that have American Legion Posts directly embedded in their communities. And from there, we establish a connection, a partnership, an engagement, and we develop a multitude of programs and services
Mhm.
that is up under the collab kind of technical umbrella. It involves prostate cancer support groups, prostate cancer book clubs, computer technological interactions. So where we have computers housed that the men that's participating in the collab study that they can utilize to educate themselves and inform themselves. And we measure it in the quote unquote lab through surveys. So it's no test tubes involved, there's no shots or anything regarding prostate cancer knowledge or information.
Mhm.
It is strictly through interactive approach through informational brochures, prostate cancer literature, and as well as understanding what is the cognitive ideal
Mhm.
idea around prostate cancer from the current man in the study.
I think that's very interesting just
Yeah.
to know that you can take the lab out of the building and bring it to the community. Uh, why do you think it's important to have that lab in the community, or maybe not in a building someplace with
Uh-huh.
glass doors and passwords? What advantages does that give us,
Yeah.
uh, in your opinion?
Yeah. I can speak a little to that. In my opinion, per se, just from looking at the historical and cultural aspect with the relationship with Black men and interacting with our hospital system, it's not quite frankly the best per se. It lacks somewhat trust.
Hmm.
So to reestablish trust, the study is so great because we have Mayo Clinic staff such as me on site facilitating the educational aspect
Hmm.
of healthcare related to prostate cancer. So it is very impactful, and I believe additional programs through other corporations should consider this approach of interacting with community members directly in the community. Because sometimes outside of the trust, there is transportation issues
Right.
with certain communities. So understanding the layout of the land per se, I mean, understanding what is the representation that you're having in your patients or participants, things of that nature, you can kind of curate an interactive approach that advances the cognitive knowledge on spaces on anything,
Sure.
not just prostate cancer, but and we aim to see if there is some benefit of this program.
Sure.
Yeah, sure.
Do you have? Can you give us like an example of
Uh-huh.
one of the studies or one of the things, or maybe your favorite, or maybe the one that you think is most impactful? Just something that's being investigated.
Yeah, sure. Yeah, so I can kind of speak to that, but I'll bring it back to the first kind of point of contact with the men. So to get involved within the collab study, you have to be a part of the recruitment process at the American Legion Post. So the commanders, the advisory boards, we have a community kind of leader aspect and our community health workers involved.
Mhm.
So they're all kind of curate the conversation around it when you have Mayo Clinic staff as well. So there's a recruitment process. And to be a part of the study, there is a survey. So it's a kind of a somewhat of a lengthy questionnaire survey, but it is digestible and readable. It's not above a high school reading level. We
Mhm.
try to make it to where everyone could have the ability to read. So after that, they take the survey, and then from there, they get to participate in the programs. And from there, after participating in the programs, they take another survey so we can measure if this implemented program or service impacts their prostate cancer knowledge.
Mhm.
So, one program that's currently going on that the Black men are loving and participating in at each American Legion Post is the Prostate Cancer Book Club.
Hmm.
So, yeah, so Prostate Cancer Book Club, we're reviewing the book from Mayo Clinic, Prostate Cancer, Mayo Prostate Health, third edition. We're reviewing that constantly, going over chapters 1, 2, 3, and 4, the whole entire book. We're currently on chapters 3 and 4, and just to hear the men's responses to um, some of the questions that they may have, or some of the things that they didn't know that they're learning now regarding like PSA level, regarding point of diagnosis, treatment options. It is very interesting to learn and to be a part of. So that's yeah.
That's a great example. Have there been any challenges or anything that sticks out in your mind that says, no, this was the thing that made it difficult, or
Mhm.
this was the tough part of getting it going? I mean,
Yeah.
maybe you say everything was smooth sailing, but
Yeah.
if there's anything that sticks out that
Mhm.
just for those people that might say, wow, that's a cool thing, maybe I want to do it
Yeah.
in my community. But what are your thoughts? What's the biggest barrier?
Yeah, I believe the toughest part, bundle of things. So the toughest part, one of the things is geographic location, and recruiting, or not recruiting, but informing the public that this program is going on. Those are kind of the most difficult part, because each community that we're going into, we have American Legion Post at 4 different locations.
Mm-hmm.
They're not the same. They all
Mhm.
have different kind of relationships with the American Legion Post. One is maybe utilized as the community center already, and one has maybe never been really used before. So we have to start from ground level up approach and kind of waning the men in to kind of be in the part of this kind of atmosphere to even talk about prostate cancer.
Yeah.
So we have to cultivate that and dismantle all of the cognitive issues or barriers that they may have
Mhm.
regarding healthcare knowledge. Cognitively have a conversation about it
Mhm.
in a critical way. So that's kind of been the most
Mhm.
kind of barrier part. But through the extensive amount of the study and interacting with the commanders and me kind of being the prime coordinator, it has been kind of on an incline due
Okay.
to some of the incentives that we offer. So if you participate in our study and do the survey, you get a $20 gift card.
Mm-hmm.
So every time you get a $20 coin card, and that's kind of like the gateway of like, oh, I'll see what it's about.
Mm-hmm.
And then once they get in, we kind of not overload, but give them a lot of information to look forward to
Mm-hmm.
in programs.
Mhm. I think that's fantastic. So you say it's on the way up.
Hmm.
Any other specific things that you do to keep it on the way up, or is there
Hmm.
anything that you're thinking of to try to get it to spread beyond what it is right now? And I
Yeah.
know this might be early,
Yeah.
um,
Hmm.
but any thoughts along those lines?
Yeah. So the way to do that, that has been working for the collab study right now, is the relationship with the management, I would say.
Mhm.
So relationship with the commanders of the post, the relationship with the community health workers. I mentioned they are part of our study.
Mhm.
Having key personnel that are community members, vocal community members in the community that people are listening to.
Mhm.
So that's kind of the way to have constant re-engagement, and we aim to have consistent um, activities or services at least once a month at each site.
Okay.
So that kind of facilitates that interaction. The men may come on their own to the post, and then the second time they come during the month, they might participate in a program like a book club, a support group session, computer access, or we have maybe a professional, healthcare professional, such as a doctor or Dr. Willis, you may come yourself to the American Legion Post
True.
and do a presentation.
True.
And that facilitates the kind of current engagement and the voices of these community members. They yearn for it, they love it, and they want it consistently all the time after they get involved.
So many people in the audience might not
Mhm.
know what a community health worker is.
Yes.
Uh, I really am a big supporter of that whole concept, but can you tell the audience what a community health worker is, why they're helping you, and
Mhm.
why they might be beneficial to the community?
Yeah. So, in hindsight, in the smallest version of it, the community health worker is a part of the collab study. They act as the conduit between the community and the American Legion Post.
Okay.
So the right now actively the community health workers are actively engaging with the collab participants, inform them that they have new brochures on site, new programs that they can offer. Always calling and reinforcing that, hey, be sure to come back to the American Legion Post. We have Quincy on site next Saturday to answer any of your questions. Answer any of your questions about the next time we're doing a survey assessment. How are you doing? Let's facilitate that conversation. So they're very vital in after we getting the men into the American Legion Post, they leave. So we can't control that.
Right.
But the way we're trying to actively control that is through the community health workers and their relationship with the post.
And they are the community health workers, people from the community. And,
Yeah.
and the second part of that question, do they call or contact people way outside of the community or just right around the post?
Yeah. So the community health workers are directly from the community. So some of these participants, they know them by name. They said, "Hey, I know Mr. Dr. Willis down the
Mhm.
street. I think he'll be great to come to this conversation." And they'll give him a call and say, "Hey, come back, come to the post," and they get signed up to be a part of the collab study. The second question that you asked me was pertaining to.
No, that was the question.
Oh,
I think no, I asked you. Yeah, the second part of the question was, do they call just the people
oh
right in
yes,
the community,
they
or can they call somebody across town if they know them? But I think you answered it. You
Well,
stick.
they can call someone across town per se.
Mhm.
However, geographic wise, we're aiming for the Black men target area.
Right.
So if we're at an American Legion post already embedded in the Black community,
Mhm.
they probably will be making calls in that circumference area.
Okay.
Okay. But anybody could be a part as long as they're
Come
in
through your
Jacksonville.
door. Right.
Yeah, in Jacksonville and come through the American Legion post.
Mhm. Another question is, how do you know that it's working? How do you measure what's going well and what's not?
Yes.
Uh,
So right now, it's kind of a multiple things, but the primary thing is the questionnaire survey that we're doing. That's
Okay.
basically how we get the feedback,
okay.
how we kind of obtain the knowledge of like, okay, this is working. So on the questionnaire, we survey them every 4 months
Mhm.
from the start of their from the start of them interacting with the collab study.
Mhm.
And after that, it's up to the program coordinator as to continuously do field notes. We do other ways, community health worker conversations. I have scheduled times with them, and as well as meeting with the commanders.
Mhm.
So I meet with them on a weekly basis every Wednesday to kind of facilitate how programs are doing because I can't be at every place at one time and just obtaining feedback from the participants while I'm on site.
Oof.
So that kind of dictates how the programs are going, or hey, this computer information, we don't know what this is. And
Mhm.
I make adjustments from there.
Are there other community partners that work with you and Mayo? Who else in the community sort of help things along? It sounds like the post is probably the most
Yeah.
important, but
The post is the most important, but we are leveraging some of their relationships they may have already.
okay.
So the collab study is perfect because the American Legion posters already have a lot of footprints going in and out of it consistently.
Mhm.
Whether it might be for a birthday party. I was one time doing a book club session at American Legion Post 197. There's a wedding going on. So they have a lot of footprints going in and out of the post. So they have actively relationships with different partners
Mhm.
that we can leverage if they're within the program scope, empower the men that way. We target around 200 to 50 men to be a part of the study.
Okay.
Mhm.
Perfect. So the post is probably the biggest partner. Why are they
Yeah.
the most important partner? Anything you can share with us about why they're so helpful?
Yeah, I would just go back to the relationship they have in the community.
Okay.
It's different
Mhm.
from anything that I have seen before versus the local community center to the barbershops or simple community parks. Military veterans are commonly found at the American Legion Post because that's where they go to be a part of program services afterwards,
Mhm.
after their time in service in the military. So that has kind of been the prime gateway to meeting people, meeting the Black men where they are, and getting as much men involved as possible.
Right. Yes. So maybe to give the audience a little bit more insight on your role, what would be your typical day at
Typical
the
day.
post? I
Yeah.
mean, any Wednesday or Tuesday
Yeah.
afternoon, you get up and you
Yeah.
go to the post,
Yeah.
or are you meeting with a partner, or are you looking at data, or what?
Yeah. So, I mean, you're hitting it right on the head, Dr.
Mhm.
Willis. So the typical day for me would be wake up, I go down to our Mayo Clinic Community Health Collaborative site downtown. So Mayo Clinic has a new location, fairly new location downtown that's directly in the community that me and the iCARE team currently works up under Dr. Adena's lab. I will check in there first. I will review data. I might do vendor payments. I might do clin card loading of the $20 gift card for the men participating in our study. I review the data of the men. I facilitate the programs that's currently being established. So I have to make sure they have enough brochures, pamphlets, things of that nature. I have to make sure the computers are ordered.
Mhm.
I have to make sure the men are being followed up with by the community health workers. So I have to do constant calls with them, ensuring that they're involved. I may do a touch point with our collab evaluators because we have evaluators on the study.
Mhm.
They just wanted to measure how successful the project is going.
Mhm.
And then I may get frequent calls from commanders saying how their week has been going or something they wanted to go over with me. And then I probably would take the little bit of half of the hour at the end of the day for writing field notes for me and how the day was
Right.
and preparing for the next meeting the next day.
Right.
Yeah.
That sounds fascinating.
Yeah.
It really sounds encouraging, and I
Mhm.
probably have said somewhere along the way to you that I've practiced for a long time,
Mhm.
and it's just really exciting to me
Uh-huh.
to see you and your team out in the community,
Mhm.
giving people knowledge that maybe will keep them out of my office.
Right. Right. Right.
Find something early, prevent something.
Right.
Because I've seen you and your team and I care work enough to know that I know a lot of it is prostate cancer,
Mhm.
but I know a lot of other good healthcare information
Yes,
is given
it is.
along the way as well. Good
Mhm.
healthy tips, that kind of thing.
Correctly.
I know we're probably at a point we need to wrap up, but I would love to give you the opportunity to say, hey, here's what I would want the audience to take away,
Mhm.
or here's the message I want to give to them
Yeah.
about the whole collab process.
Yeah.
So, any way you want to summarize
Yeah.
things, or just leave us with whatever your best, most important thoughts are.
Yeah. So currently, right now, in regards to the collab study, if anyone would want to replicate this, you have to know the personnel or identify who would you want to work with, because that makes this program all kind of work and function. Um, I'm just one person in this whole circle and triangle and square,
Sure.
this whole shebang that we're doing with the collab study. I may be the prime contact for the study. However, the commanders, the community health workers, the additional members on our staff, as such as the research project assistants, they really all make the project work so that when we get in front of the men to sign them up, to recruit them, it's a seamless process. So number one, we have to identify who we want to work with and what community that we're targeting. and that makes a difference regarding prostate cancer knowledge and education. And we need more programs such as this.
Mhm.
So I really enjoy it. I've been fortunate enough to work in this program for about 9 months now. So I'm fairly new, but I've enjoyed every second of it. And to witness the light bulb turn on in Black men's head too about prostate cancer diagnosis, treatments, or simply PSA levels, it's enlightening and something that I personally will take back to my family. So, yeah.
Thank you very much, Mr. Quincy Wimberly. And I'm Floyd Willis. This is another episode of Men's Health Matters.
All right, so that was an episode of Men's Health Matters, and it's actually a perfect episode to go ahead and segue into the special surprise that I have for us. Since we did have in that episode of Men's Health Matters, we had Quincy Wimberly discuss a little bit about collab. We are going to full-fledged get into this collab surprise.
In every community, health begins with a connection, but service never ends. And caring for one another is a lifelong mission based on the trust and the community. To achieve health equality for all traditions must meet transformation, where health is not just about medicine, but belonging. From the onset, the community must be at the table with equal power to make the right decisions for their community.
Through the Community Living Lab Precision Community Health Initiatives, conversation becomes a catalyst for change, brings together data, dialogue, and dignity. Every voice matters. Every story reveals another layer of what health truly means, especially for Black men facing prostate cancer diagnosis. Grounded in community trust and ownership, moving from precision for communities to precision with community.
From American Legion Post to community wellness centers, the Prostate Cancer Transatlantic Consortium is helping people access care where they live, learn, and serve. Because precision community health is more than science. It's empathy, access, and action. Rooted in equity and context, it addresses social determinants of health and structural risks at community levels.
CoLab Precision Community Health Initiative uses real-world data to identify barriers, foster community engagement, build trust, track outcomes, and tailor care, transforming information into impact. Every number represents a person. Every insight brings us closer to healthier communities.
At the heart and precision of community health is the human spirit. Resilient, hopeful, and united. Interventions are context-sensitive and community-tailored, not just statistically targeted. Together, we are building a model of care that listens, learns, and lifts every community, one partnership at a time.
Thanks for joining us in our brief journey of our work on precision community health, powered by the Prostate Cancer Transatlantic Consortium. Globally, our consortium is a leading consortium in both precision public health and precision community health. For precision public health, we use community engagement, community data, and technology with geographical precision to prevent disease, predict risk, and tailor interventions to improve community health and reduce disparities. For precision community health, we tailor health interventions to specific communities considering social, cultural, behavioral, and environmental contexts. At our CAPTC Collab hubs, service meets science and care becomes the community.
Okay, I hope everyone found that meaningful. CoLab is a collaborative initiative that's aimed at breaking down the barriers to clinical trials participation. By bringing together patients, healthcare professionals, and community partners, it highlights how education, access, and trust can drive more equitable health outcomes. What we just watched is a commercial for CoLab that highlights the work of the Prostate Cancer Transatlantic Consortium, as well as focuses on the precision of community health. This approach brings together data, dialogue, and community engagement to better understand as well as address health disparities, especially amongst Black men affected by prostate cancer. It emphasizes that something really important. Health solutions work better when communities are not just included, but actively involved in shaping the care that they receive. All right. So the full collab commercial will be uploaded onto our YouTube channel very shortly. So you can go back and watch that. And I do apologize. It is raining cats and dogs over here in Texas. So hopefully the thunder isn't too loud. But we are going to go ahead and get into our next episode of Men's Health Matters. We might have to cut it a little bit short just due to the time constraints, but the full episodes, both full episodes are uploaded onto our YouTube channel in which you can watch the full episode in case you miss it. So let's get into this next episode of Men's Health Matters.
Prostate cancer is an enemy.
Welcome to Men's Health Matters. I am your host today, Quincy Wimberly, current program coordinator with Mayo Clinic. Today, we are interviewing Mr. Charles Walden, current prostate cancer survivor of 5 years. We'll have a little conversation with him today. So thank you for being a part of us today.
Hey, thank you for giving me the opportunity, Mr. Quincy.
Yeah, it's always a pleasure.
Yeah.
As we get right into it, talking about your experience with prostate cancer, your pathway to survivorship, and some of the symptoms you're having, one question I will ask you, what was your life like before receiving the diagnosis?
Well, my whole thing has been my athleticism.
Okay.
You know, in high school, I played 3 sports: football, swimming, tennis.
Wow.
And what was that other one? Baseball.
Baseball, yeah.
Yeah, I did that 1 year. When they had a teacher walkout in Florida.
Okay.
And the head coach was a baseball coach that year. And all he knew was football players.
Yeah.
I got to start like that. But it was fun, you know.
That was pretty good.
Yeah.
That's pretty good. So you would describe being physical activity.
Yeah, you know, that was my I went to Florida A&M University and I majored in health and physical education. So I knew what I wanted to be.
Yeah.
I wanted to be a coach.
So your general health was already good.
Yeah,
before
yeah. No, man,
that wasn't even
I
in your
didn't smoke in high school.
Wow.
If I drank, I was faking. You know what I mean? I'm just saying.
Yeah.
You know, I was ready to clean.
Okay.
You know.
So were you familiar with the term prostate cancer? Was that even a thing in your family history? Your brothers,
I had the kind of father that he must have had 6 different things before he died. You know. Yeah. So I you know, I became aware of a situation pretty early, and they just didn't have the technique to get the blood. They was doing the hand, you know, thing and how large it is and all that. That was okay, but they needed more.
Right.
And
right.
That's what they had gotten by the time the prostate was a big issue. So I was prepared. You know, I wasn't surprised.
Familiar.
Yeah. I was familiar with, you know, what my body could do and what it can't do and why you do things, you know. So I was always thinking about something like that.
So you said you were prepared based on, you know, your family history, talking with your dad, or just experiencing that with him.
Right.
Just for the audience and for this conversation, could you walk us through the point of diagnosis? So what was that feeling like? How were you going through? What did you tell your significant other, your wife, maybe?
Yeah, that was the toughest part, because in my for what we got in the military was a once a year checkup from a primary care doctor.
Wow.
That's what we do. So as the primary care doctor, Dr. Robert Lee was evaluating me. He was giving me all these accolades about how, you know, how tough his day been and how easy it is once I got there, you know. And I got a little distracted from that, where I wasn't really paying attention to what he's doing. You know, I wasn't watching
I was just
examination.
right. I was just
Yes.
taking for granted that everything was going along fine, but it wasn't. See, because for 7 years I wasn't tested,
Wow.
you know, and then I got a call from that doctor, Robert Lee, and he said, your score is high. That's when they were scoring. Come and get another one, see if it's going down.
Yeah, your PSA levels.
Yeah, PSA. It had gone up even more.
Wow.
And he gave me a write-out of what he had been testing, and it was up and down, up and down, up and down, and then nothing for 7 years, and then way up.
And way up.
And that's how I got into
the diagnosis.
The diagnosis. So I came in the diagnosis a little disturbed, you know, about what happened, because that gave that gave it time
to continue to prolong.
Right. You know, I should have caught it earlier.
Yeah.
You know, should have caught it earlier. But it's time to go into
treatment
now.
Right away.
You know. So that's how I got there. So I was ready to do whatever it took.
And did they have?
Because I was taking care of my mom and daddy during that time. My daddy had Alzheimer's. My mother was sick. You know.
So he was a caregiver during that time.
It was a care. You know. So I had to take care of. So I had to take care of myself and them. You know. So I was ready for whatever was coming. You know.
So that was very difficult. So
well, you know, it's just like if you're not prepared, you might not win.
Right.
So I'm gonna be prepared.
Yeah.
So I'm looking to win. That's how I come into it. I ain't come into it dragging. You know.
Yeah.
You see where I'm at now.
Right.
And I want to help somebody else.
And that's a great thing.
That's what you got to do.
So did they have a you're ready for whatever, and we're gearing up. We were already at the point of diagnosis. We took time to ourselves, and now we're like, all right, how will we beat this thing?
Right.
Did they have a treatment plan that kind of established? And if they did, what kind of was it?
But the treatment plan came from a doctor that I respect. I got this information now to carry on. And he saved my life. He was old school. He had prostate cancer himself.
Wow.
But he came up in a different era now, and he told me the procedures they was doing there. That wasn't too good. You know, I was glad of that, you know. But he was all in. You know, he you know, he said it's treatable. He said curable. He said it's treatable.
Treatable. Yeah.
So that's better than terminal.
Yes.
See what I'm saying? That's the word I didn't want to hear.
Yeah.
You know. So you know, so I was in it. I was in and winning, you know.
Okay.
Yeah.
That's good to hear. You had a relationship with your doctor. It seemed like
I mean,
consecutively interacting.
it even got better than that. When they go, I was able to get a colonoscopy.
Okay.
You know, before I got the treatment, because I was concerned about that, because I was already on the colonoscopy watch.
Okay.
I told you my daddy had 4, 5, 6 things. You know?
Right.
So I was doing that already. And so I got that done, and then I went into my treatment, you know.
So he was being proactive even before.
Oh man, for sure.
Diagnosed with
then when I got my treatment, I saw somebody look like you.
Yeah.
On top. Yeah, he was in charge. That made me feel even better.
Yeah.
I'm talking about, man, come on.
Yeah. So identifying someone that looks like you in the healthcare field,
get everything, especially after what I've been through with my doctor.
Right.
Robert Lee.
So hearing that, it sounds, I'm not shedding light to your, I'm not, you know, everything, it all wasn't positive, you know, or happy, joyous. I know some down times. So what was the most difficult time or process that you can remember during your treatment with being diagnosed with prostate cancer?
My brother was going through the same thing.
Wow.
You know, the same thing, just in a different city, different hospital at the same time. And my pastor.
Your pastor, yeah.
Said,
all at the same
he was a
time?
former NFL football player, the new pastor, because he told me he got sick, and that's why he didn't make it in the pros. He said he had to get a job. So, and when I met him, man, we went straight to the golf course.
Yeah.
You know, I had seen a preacher that played golf in a minute. You know, the last ones I played got all my money. You know what I mean? But
So
not
good.
this guy. He was a good guy.
That was good. So y'all had active conversations about it during golf?
Yeah, 3 people going at it at the same time.
Right.
He was getting his mostly in operations. My brother had the biggest next to Mayo Clinic. He was in that kind of situation.
Okay.
They making 6 days, and me, I'm struggling, trying to stay alive with my mom and dad. You know, one with Alzheimer's, the other thanks she got out. You know, I mean, it was a tough time, but like I say, when you prepare, you can win.
Yeah.
You know, when you prepare.
Yeah. So would you say that was like a great support system for you during that time to
Family, man. It's all about family. For us, you know what I mean? I don't know about nobody else now.
Yeah.
Because I can remember when the family, you know, when I was young, how the family treated us, you know?
Hey, we resorted back to that.
Yeah, I mean, you know, we used to have to go in the back door of the hospital.
Yes.
Not no more.
Not no more. We go to the front.
Yeah, almost bled to death one time like that.
Wow.
I died on a piece of glass. My mama sitting up there holding me, you know, because they ain't saying nothing. My daddy came in there and tore the place up.
Wow.
I'm just saying, you know, you have to be able to do what you got to do.
So we talked about the point of diagnosis and we talked about the treatment journey and how your support system was basically great for you and having a relationship with your doctor.
Right.
Looking back at it, was there anything that you would have changed during that process or done differently for yourself or anyone around you?
The whole process was, I was so into it. I mean, give you an example. This thing, you have to hold, they look at your bladder. Your bladder got to be a certain level of water before they can even put the radiation on it, because you have to look at the prostate. A lot of people cheated on that.
Wow.
I mean, I'm just saying, and because the first time they ran the just to do it without, you know, the free run of it, you know, you know, I cut loose right there. I mean, you know, it's that tough. And you got ladies, because they're doing all the hard and good work. So I got a lady in my crew. I got this, you know, and the first day in the warm up, couldn't hold it because I wasn't used to it. Because I drank water all the time, you know.
So bladder was
so I gotta figure out how to control my bladder and to be able to hold it for 5 minutes while the radiation without turning it loose.
Wow.
Boy, that ain't easy.
Yeah.
You know, that ain't easy. But man, I had all kind of ways to do it. I'm drinking water on the way. I go to the bathroom. I mean, it's all kind of ways, man. You know, and you just fit in, you know.
Yeah.
You know, and get in, you know. And one day you'll ring the bell. So I was waiting to ring that bell. And I chose, so you could get a short version with higher, or you get a long version with lower.
Okay.
I took the long version.
Yeah.
When I took it, I wish I had though, because it was tough, you know.
Referring to the radiation.
But, yeah, I mean, because it was just a long time. And see, something else that helped me, you know, I like to fish. So the COVID was out.
Okay.
You was lucky to even get on the operating table with the COVID.
Yeah. So COVID slowed down your
slowed down everything, man. It slowed down the whole world. You know that. And for you to get cancer in that stage, that's another one.
What stage was it at?
Well, it's the stage 3, you know, whatever it was treatable.
Right.
You know what I'm saying? That's the main word. It ain't the number, it's the main word. As long as they say treatable, you got a shot.
So what other symptoms you were having? I mean, you mentioned your bladder. You was having trouble holding your bladder, but what other symptoms you had during that time?
Well, the thing was, they'll give you pills so you might not urinate as much.
Okay.
You know, I didn't like that, you know, although I got the pills, but I didn't like it because it was too, man, I'm already messed up. You know, it ain't fit in. What fit in for me is I got to figure out a way to do it without the drug.
Okay.
You know, so that's what I did. I just, you know, and I only had one time that I was close where soon as it was over, then I turned it. I mean, I did that one time. And they have towers over me, girl. You know, I mean, I'm saying it wasn't as embarrassing as it would have been if I had to do the whole thing over. Sometimes they don't even let you do it. They bring you back another day. If you don't be able to do it, you know.
Okay. Yeah.
So it was, you know, it seemed like I talked with my brother, seemed like he was cheating a little bit. You know what I mean?
Your brother went through the same thing.
Yeah, but you know, he ain't sound like me though. You know, I think he was cheating a little bit. They might, you know, with my crew, I ain't even want to go. You know, they didn't have to get to that. I was going to do it the right way. And my doctor, he was so good that he saw where I was losing blood.
Wow.
All right, my primary care said it was okay. You know,
Yeah.
my doctor up there said, well, it ain't okay to me. So he offered me something that I had offered before, and I turned it down. Like going up in your thing and putting that tube to get to your bladder so they could see it. He wanted to see if I got any things that the things that cause cancer when you take them out, you know, whatever that is in there. They go, they can look at it and see if you got that.
Yeah.
So he went
was
up
running
and,
more tests.
huh?
He was running more tests.
Yeah.
Yeah.
He was concerned.
Sure.
He was concerned about me, man. You know, and I trusted him. He went up and down, and you could see it at the same time you take the thing. You could look at it. You know, you see exactly what he's doing.
The camera, yeah.
The camera, you know. And so, you know, they didn't put me to sleep. You know what I mean? So it came out okay, but I saw how my bladder was all burned up. You know.
That was concern for you.
Well, I mean, I just looked at it, you know, and at least I could say I knew how, you know. He wasn't, you know, he didn't, you know, say I got to go and take them out. You know, I just it was burned up a little bit. But that radiation went to where it's supposed to go.
Right.
You know, to get that cancer out. So
yeah.
So it was a success, man. You know, I had a success. But you have to be careful because you can't give give it a 7-year advance when it should have been called a 10. You know, you got to be on top of your game.
Yeah.
You know, in order to survive. So I learned that. So after 5 years, it just happened. They send you to your primary care. Now I'll go back to my main man that saved my life no more. But I went back to him just for a talk. I gave him a card of my people and told him what we was doing and that, you know, and right in front of some people, you saved my life, you know, because that's how you got to do.
Yeah.
You know, and he was just concerned, man. He was good. He was real good.
So when you heard the first words after basically the doctor saved your life, as you say, when you heard the first words that you are cancer free, how did you feel?
I felt good because I could take care of my mama and my dad. You know, I had them both till they died, you know, through all the COVID and everything and all that, you know. So that was a prayer answer, you know. That's why I pray, because they will be answered if you believe. So I believe, you know, and I know it's a tough thing. There's no cure, but what you do, you try to be successful and help as many people as you can while you can. I mean, I just watched the lady get a liver transfer, not because she was gonna survive, because she was gonna be the first.
Wow.
You know, and she was tough. You know, and her brother gave her the liver.
The liver, yeah.
Now he's limping around, but they was in India and he married the girl. You know what I mean? So at least he got a beautiful wife out of the whole thing, you know.
Wow.
But that's the kind of courageousness you have to have once you diagnose and you because the man that really helped them, he wasn't a doctor.
Wow.
You know, but he was smart. You know, and that's how a lot of good ideas come about, not from the doctors and the, you know, but just from smart people. You know, so everybody, you got to listen to people.
Yeah.
You know, you got to listen.
Yeah.
And I gave him another to my new primary care doctor.
Okay.
I gave her some help because she was going by this thing that since I been given over to her that she was going to check my PSA once a year. I said, no, not once a year.
Okay.
Not once a year. Twice.
Right.
I'll do it every month if you let me, but you got to be at least twice.
Right.
You know, I give it a 6 months, but I'm not giving it a year.
So what did she say in response?
Oh, she done everything I asked her to do. She got me a hernia surgery going. She got me a colonoscopy. She's doing everything. She's doing everything.
That's great to hear that.
And she just got here.
Yeah.
And she's from another country.
Wow.
Ain't that something?
That is something.
Man, but look, it's up to you.
Yeah.
You know. And she appreciated what I told her because I told her how you can go to the dentist and your insurance don't cover cancer. I mean, but it cover that blood thing they got. What diabetes.
Okay,
You
diabetes.
get $350.
Yes.
But you'll get nothing for cancer.
Insurance.
All they
It's
do now,
difficult,
all
yeah.
they do now is clean my teeth. They won't do nothing else.
Yeah, it's difficult. Insurance is tricky navigate.
Right.
Yeah. They want you to pay
So
more
I
to
got
cover
my
them.
doctor. I told her the first doctor, I said, you know, how about me? They haven't done my blood for diabetes for 3 years.
Wow.
I said, what? See? I said,
Yeah.
I see what I told you. See?
Yeah.
So you got to check my
You have to be
diabetes.
proactive.
Yeah.
And talking with your
Gotta
healthcare
Yeah.
professional.
See, so I
your
woke
medical
up.
record.
I didn't let her go through what. No, you don't do people like that. If you check them once a year, you got to do the diabetes.
Yeah.
It's too, you know, you got to do it. So she appreciated it because she's doing everything I asked her to do.
That's good.
I mean, she came through for me.
So what, as we kind of wrap up here
Yeah.
in the last couple of questions that we have, so what advice or words of encouragement would you share to someone or another man going through prostate cancer at the point of diagnosis or currently going through treatment or, you know, looking forward to survivorship? What kind of advice would you give to them?
Just look at this film.
Uh-huh.
You know,
Yeah.
it'll be self-explanatory. That's why
Yeah.
we're doing it. You know, to talk to them,
Mm-hmm.
to let them know.
Mm-hmm.
But in person, that's another thing. That's why I do comedy now.
Wow.
I'm just saying, I'm over to on Wednesdays.
Yeah.
It's $10, y'all. They don't tell you that.
Well, we'll have to come check you out.
Well, that's what I'm telling you right now. It's my platform. And I want to say a hello to my cousin, no, my brother, Carl Walden. He's in Kentucky getting some medical things going on.
Wow.
Planning on running for president.
That's good.
He's smart.
That's good.
He's real smart. I'm serious, man. Not smart as you though, Chris. You smart.
I try to be.
You are, man. I will tell you, I know smart people. I've been around them all my life. I went to school with them here in Donnell Cookman.
Yeah.
They do classes like that, man. They just put all the smart and the rich people in one class.
They do.
Then they have a few. And I was in there, and I took a test wrong, and they put me in the trail.
Oh man!
Until my mama found out, man, she put me back in the regular class. I had a good time out there, though, man.
That's good.
No work or nothing. Teachers sleep, fighting all the time. Oh man, it was something.
So, as a Black man, and knowing that prostate cancer is kind of a leading death in our community, what steps do you think should be taken to address this in our community here, as well as in our states and at a national level for Black men specifically?
Right.
What do you think we should do to talk about it, to have more people to kind of reduce?
Oh
the
man,
death rate? So
I love that. I love this question, Chris.
Yeah.
Tiger Woods, if you listener,
Mm-hmm.
we need you.
Mm-hmm.
Because we need to build us a hospital
Okay.
just for us.
Okay.
There's nothing wrong with that.
Mm-hmm.
Right?
Yeah. There's nothing wrong with that.
Can you second that emotion or what? You second it?
I second it.
That's good then. I mean, it still be all right. And then they'll see all this, you know, it'll be there all the time for them, you know, and then we'll build them all around the world, not America, just the world.
And
you know?
we educate.
Educate. I mean, I'm watching African movies, man, and I be thinking about, well, how'd they go to the bathroom? You know, I remember them outhouses. You don't remember that?
Yeah.
Yeah, I mean, you better be glad, though. I remember, you know, outhouses, man. You know, I didn't even see the outhouse. You know, thing is, it can get better.
It can get better.
Just by having a movement.
Right.
For something like that.
Right.
We could build, man, we could change the whole world if we do it right.
I like that. So, Mr. Charles Walden, as
Yes,
we're going to wrap up today's session, as a Black man with prostate cancer being one of kind of the leading deaths in our community, what do you think needs to be done to kind of address this critical issue in our community nationally and state level? What do you think should happen to get more Black men to reduce the deaths rates regarding that?
Well, I tell you, Quincy, I think what's really is gonna help us is things like this that Mayo Clinic is doing. They're doing this type of
community
service, and you get an opportunity to tell the brothers out there that this is serious.
Right.
You know, you don't have to be a millionaire. You know, You could just be a regular person and go to your people and let them know that you got a problem. You know, go to your doctor, let them know you got some symptoms. You know, just be smart about it. Don't wait,
Right.
because time is an issue.
Wow.
You know, if you got this help, if you can get this help, go get it. Don't wait around, because the longer you wait, the less your chance is going to be. So you have to be aware of going and communicating with other people,
Right.
you know, with anybody.
Anybody.
Talk about it. You know, it's not that bad if you treat it. Now, if you wait too long, can't treat it.
Right.
It's too late.
Right.
And there's no reason now for it to be too late. They got too many things going. Look at what Mayo Clinic is doing. Everybody should be trying to imitate that, you know.
Right.
But now, somebody have to be number one to do it. That's us. You take care of yourself.
All right. So that was the next episode of Men's Health Matters. We did have to cut it short a little bit, but the full episode will be posted on our YouTube channel. I just want to thank everybody so much for joining us today for both episodes of Men's Health Matters, as well as for watching the premiere of our collab commercial. All will be posted on our YouTube page. And we hope that this episode helped bring light to strength and honesty, as well as a lived experience of survivorship and why these conversations do matter. We truly appreciate you being here, and I hope everybody has a great start to their weekend, has a blessed weekend, and stay safe. We'll see you next time.